Good morning. My name is Frank Mazzagatti. I'm a healthcare attorney at the law firm of Mark Essegrari and Associates here in Smithtown, New York. And we'd like to welcome you to the Suffolk County Long Island Eldercare channel, a web-based resource guide for all things relating to the elderly. Today, we're fortunate to have with us Julie Simaluka, who is the Public Relations Representative for Community Care, also located here in Smithtown. Julie, welcome this morning.
Thank you. Nice to be here.
Pleasure to have you. We obviously are a law firm that does not only estate planning, but we have a robust elder law practice. And what we're trying to do is to build a set of resources available for our clients and members of the families that answer commonly asked questions relating to the elderly and the issues that generally arise. Could you define for us what home care is for the elderly?
Okay, well, home care basically is a means to keep the elderly comfortable in their home. They don't necessarily want to go to a nursing home if they're not ready for that stage yet and they want to stay in their home. We can provide the home health aide or a companion to come into their home and keep them comfortable and keep them active. It's just a means to keep them in their home and comfortable for as long as possible. We'd like to keep them as long as possible in their home.
Right. Are there any issues that generally arise that where you couldn't keep people in their homes, even if that's their preference?
There are some issues, yes. What we do is we have a nurse that goes into the home and does an assessment. Now, if the nurse decides that they need a higher level of care, if they're not suitable for home care, then that would be an example of a time that we can't provide care in the home for them,
Right.
and they'd have to go to a nursing home.
Right. Good. Now, how important is it for seniors receiving home-based healthcare services to remain independent?
Very important. It's very important for them to remain independent for their own health and happiness. Most people do not want to leave their home, and they want to stay as long as possible. So by bringing a home health aide or a companion into their home, they can take them out to different activities, or take them to the park, take them to the movies. They can go anywhere they'd like, take them to do shopping. It helps to keep them. They say the longer you work, then the
Right.
longer your mind
Sure.
is active. So it is very important to keep them independent as long as possible.
So it's not only just limited to perhaps physical ailments, but the psychological welfare of the applicant or of an individual receiving care at home is equally important.
Correct. Absolutely.
How important is it for the elderly to be able to conduct activities of daily living?
That's extremely important as well. Sometimes it depends on the situation, but if they've had, say, a hip replacement and they can't do these things on their own, it's important to have somebody there with them to bathe them or to help them with toileting and just all activities, meal preparation. Um, Sometimes they don't necessarily want that help,
Mhm.
but it is important to have somebody. And for the children of the elderly, it's a huge burden off of them to have somebody else come in and help.
How do home care professionals create and maintain a safe living environment?
Well, when our nurses go in, our nurse will go in and open any case that we have, any applicants that is looking for home care. We have a nurse go in, they do an assessment, and from there they're going to write out a plan of care, and they will, check out the home and make sure that everything is safe and they have all of the equipment that they need, any assistive devices, and make sure that everything is in place. And they set out a plan of care that is always on the table, on the refrigerator. It's always in plain sight. So from that plan of care, the home health aide then knows, or companion, they then know exactly what needs to be done during the day, what they need a little extra help with, what they may not need help with, and that's how they plan the day.
Now, during the initial evaluation by the nurse who comes in from community care, Will it be identified if, for example, at the top of the stairs that there's a loose carpeting, or if there's a need, for example, to have a handrail installed in the shower?
Mhm.
Those things I would think are oftentimes overlooked until someone sustains an injury. So is that part of the
Right.
initial
It,
evaluation?
it is. It is. Yes. We go over everything. She'll check out the whole house, every room, and make sure, particularly the handrails, that is
Right.
very important. And from there, we don't necessarily take care of that ourselves, but we always have an abundance of resources and different agencies that we work with. So we can then resource them out to somebody else
Mhm.
and get somebody in there to fix that. If it is a very dangerous situation, then we won't proceed until that's taken care of.
Mhm.
Make sure that they have, total safety in the home
Good.
before we go in.
Right. Yeah, that's very important. Are there signs that children and other caregivers should recognize that may indicate professional care and services are really necessary in the house?
Sure, there's plenty of signs. I'd say, most of our client base is beginning stages of dementia, Alzheimer's. Um, you can see signs by forgetfulness.
Hmm.
Maybe they get up in the morning and they think it's time for dinner, and
Hmm.
they'll start, mixing up their schedule a little bit. So um, signs like that, forgetfulness, maybe combativeness, um, not eating, a loss of appetite, and forgetting to eat, forgetting to take the medications. Those are all signs to look for that may indicate a need for home care, a
Right,
little
right.
extra help.
What is community care as a business, and where is it located?
Okay. Community care has been around for about 30 years. We started as a companion agency, and about 7 years ago, the current owners, they took over and they brought on the license part of it. So about 7 years ago, we became a licensed home care
Hmm.
agency, and now that allows us to have the medical aspect, to have the home health aid. So we not only do we offer companion services, we also offer home health aids. We offer skilled needs as well. We have professional placement. We also have wound care, insulin injection. If there's any other special needs that they need, if they're
Hmm.
diabetic, we have a nurse that will go in and perform the insulin injection for them. We have somebody that can go in and do the med course for them. So they'll plan out their medicine for the week and they'll separate it for
Hmm.
them and they'll be ready for the week. So depending on that particular person's needs and what their you know what their state is, I guess, then we go from there. But we do provide a full continuity of care from companion care, which is somebody to just go in and help with the meal preparation and just maybe keep them active and take them to the park, as I
Hmm.
said before, take them out to the movies. We have the home health aides that stay in the home. They're more hands-on care. It's more medical, so they can help with the bathing, the grooming, toileting, and actually give them medicine, administer the medicine. So from from that point on, when we brought on the license part of the agency, we have grown exponentially, and community care has an excellent reputation in the community. Um, we we just opened an office in Queens. We have a satellite office in Riverhead as
Hmm.
well, and we're looking to open one in Connecticut very soon.
That's terrific.
So yeah, so within the 7 years that they've taken over and brought on that license part of it, we've grown quite a bit, and we're still growing. And we have a great staff and wonderful aides, and we're looking to we're gonna continue to grow.
Well, there's such a huge need for these types of services, particularly here in Suffolk County. How many employees do you now have?
We have that's hard to say. We're constantly bringing, and there is a huge need, and
Mhm.
we're constantly looking for more more help, more home health aides,
Mhm.
certified home health aides, more companions. So currently we have, as far as the aides and companions, I'd say roughly about 150.
Mm.
So that is quite large
Yeah.
compared to some other agencies. That is pretty large employee base that we have. Um, and then we also have the office staff, of course. We have the coordinators, which, that's It's a very stressful job, but they are amazing, and that is what keeps this company. They're the heart of the company.
Right.
What keeps them going. So we have the public relations representatives as well, and but as far as home health aides and companions, I'd say about 150. But always looking.
That's good. Well, that's always good to know for individuals who, for example, are looking for work in this field and you're certified. Certainly give Julie a call at Community Care. Some elderly generally express a concern about having strangers in their homes. How does Community Care screen its employees, for example?
Okay, all of our employees are background checked and screened through. Not only are they background checked here in the United States, but a lot of aides in general across the board come from other countries, Haiti, Jamaica, for example. They're also screened. They're also background checked in their country as well, where they come from. So we go through several different avenues to make sure that they have a clean record and that they are up to date with all of their, immunization health-wise. We make sure that they're up to date with that. We have a sister company called Aero Security, so we also screen them through our sister company as well. So we go through several different avenues to make sure that they are ready to work and good people. Every aide that comes into our facility for an interview is also interviewed by our owner directly. He's very hands-on with that, and he wants to make sure that he knows and he meets each home health aide, each companion personally. So, he likes to meet them one-on-one, and if they're not a good fit, we don't take just anybody.
Right.
We make sure that our aides are competent people, caring people, nurturing people, and that they're there to do the right, right thing. Right thing. So also a concern, sometimes they do have concerns about a stranger coming into their home. So, we try to work with everybody on an individual basis. And what we can do if somebody needs a live-in, for example, and they've never had home care before, and they're a little nervous about somebody just coming in and living with them. So we can bring somebody in as sort of a meet and greet, get to know that aide, and decide if that's the right fit for them. We try our best to match compatibility. So if we have somebody who's 86 years old and maybe is a war vet and wants to talk about the glory days, then we're not going to have a 22-year-old come in who is texting on the phone the whole time and has no interest. So we do our very best to match compatibility as well.
Yeah, that's terrific.
Yeah,
that's important. That's a huge piece to develop the relationships so that folks become comfortable. What forms of payment does Community Care accept for its services?
Okay, Community Care, we are always growing our contracts with MLTCs. So a big part of our payer sources is private pay. We do accept private pay. Another huge payer source for us is GuildNet and Medicaid. So we do have a list of MLTCs that we're contracted with. So if anybody has questions about exactly what we take, you can always contact me directly, and I'll give my number.
Exactly, and that was my last question as to for anybody who's looking at this video, how can one contact you?
Okay. You can contact me directly. I have a mobile number that's always, my cell phone is always with me. It's attached to my hand. So my cell phone number is 631-464-9528. You can also contact the office at 631-549-9500. I do recommend calling me directly just so you don't have to go through the office, the shuffle in the office, because sometimes it is a little bit chaotic with all the calls coming in. So that's why the representatives, that's why we're out here, so that you have a direct line to somebody that can get the ball rolling quickly for you.
Terrific. Terrific. Well, we thank you for being here with us this morning.
Thank you for having me.
Again, we want to bring the most current resources available to the Long Island Suffolk Care Eldercare channel, and the link for Community Care and the ability to access Julie will be posted on our website for you to freely access. We want to thank you for joining with us this morning, and we look forward to seeing you again. And we always consider it a privilege to be able to serve anybody who needs these types of care. It's our pleasure to do so. Have a very nice day. Thank you.